The Ministry of Health has noted with concern an article that was published in today's Daily Monitor titled Museveni Inner Circle Got COVID Jabs, US Paper. The Monitor article further quotes an American newspaper, the Wall Street Journal, that reported that members of President Yoweri Museveni's inner circle were offered vaccines from China state-owned drug maker Sinopharm. On behalf of the Ministry of Health and the government of Uganda, I want to categorically state that neither President Yoweri Museveni nor any of his inner circle have been vaccinated against COVID-19. As alleged by both the Daily Monitor and the American newspaper, the Wall Street Journal. Both media houses are spreading false and unfounded information with potential of misleading the population and defaming the name of the president. In December 2020, the government of Uganda, upon request from the Chinese embassy in Uganda, authorized the importation of 4,000 doses of the Chinese COVID-19 vaccine for Liao Shane Industrial Park in Kapeka, Nakaseke District, through Sino-Africa Medicines and Health Limited, strictly for exclusive use by the said Chinese nationals in the park. The ministry would like to reiterate that these vaccines have not been used for any Ugandan other than the target population, that is, the Chinese nationals living in Kapeka. Uganda is set to access COVID-19 vaccines as follows. First, from AstraZeneca, from Serum Institute of India, the AstraZeneca vaccine, where Uganda has placed an order for 18 million doses. Out of these, 400,000 doses will be initially provided for by mid-March 2021. The rest will be provided in a phased manner. 2, donations from the COVAX facility. The COVAX facility has communicated a tentative allocation of 3,552,000 doses of the AstraZeneca vaccine to Uganda. Of the above allocation, 864,000 doses will be shipped into the country by mid-March 2021, while the rest will be provided on a quarterly basis in the course of 2021. 3, a donation of 100,000 doses of the AstraZeneca vaccine from the government of India. The ministry is concluding on the requirements for shipping. The arrival date of these vaccines will be communicated in due course. And 4, a donation of 300,000 doses of the Chinese COVID-19 vaccine from the People's Republic of China has been communicated to the government of Uganda recently. However, modalities of receipt of the vaccines have not yet been concluded. It is important to note that none of the above-mentioned vaccines have arrived into the country. Currently, the National Drug Authority has only registered the AstraZeneca vaccine for use in Uganda. NDA is still in the process of registering the other vaccines. Therefore, His Excellency the President or his team could not have been vaccinated with vaccines that have not yet arrived into the country or duly cleared by the National Drug Authority. The government of Uganda will provide a clear and comprehensive vaccination implementation plan to the country, and this will be officially communicated by the Ministry of Health. The African Union has secured a good number of vaccines for the African continent and has provided allocations to various countries. Uganda was allocated about 9 million doses. However, funding modalities are still being worked out. And from the African Union, Uganda has been allocated the Pfizer and the Johnson & Johnson vaccines. Let me state here that Uganda has capacity to store vaccines at -80 and -20. Many of you will be aware that we have already been storing the Ebola vaccines, which are stored at -80. Although the capacity is limited, we are able to store up to 500 doses at -80. So should we decide to go in for this vaccine, we are not worried. We are also able to store a small quantity at -20. So as soon as the funding modalities are worked out with the African Union, then we shall communicate to you whether we are receiving these vaccines or not. On the issue of the numbers we are targeting, I think I've already talked about it. Each person is eligible for 2 doses of the vaccine, 28 days apart. And the government of Uganda is committed to vaccinate her citizens. The government of Uganda is mobilizing resources, and that is why we have placed orders for the vaccine. Can Ugandans get the Chinese vaccine, the one which was brought to Kapeka? No, because at the time that vaccine was brought in, it was still under research. So once a vaccine has completed the 3 phases of the research and has been submitted for WHO approval, that is when we begin to discuss the vaccine. So at the time it was brought in, it was still undergoing research. On the issue of His Excellency the President being a citizen and having a right to get vaccinated, true, he is a citizen of Uganda and he has every right to get vaccinated. But His Excellency the President from the onset has been very concerned about the citizens of Uganda, and he made it a priority to ensure the lives of the citizens of Uganda as well as to secure their future. And he has been pressing forward for the need of vaccines to vaccinate Ugandans. So the President is looking forward to seeing Ugandans vaccinated. Therefore, he cannot take a decision to get vaccinated before Ugandans. And so allegations coming in that the President went and got vaccinated, meaning that he's thinking about his safety first, is absolutely wrong and untrue. Once we have vaccines in the country and we have issued a statutory instrument, every citizen in the country is free to take a decision, an informed decision, whether you want to be vaccinated or not be vaccinated. But the government will provide the vaccines. Uganda took a decision to provide the AstraZeneca vaccine and the Chinese vaccine to its citizens because of its characteristics of the cold chain. Those 2 vaccines are stored between 2 to 8 degrees centigrade. We have built capacity over the years for vaccines that are stored at that temperature. Many of you are aware that we have over 13 different antigens that are offered to the population of Uganda, majorly children, up to date, and these vaccines are stored at that temperature. Therefore, in our choice of vaccines, we are cognizant of a capacity that can be adequate for the population that we target to vaccinate. So we cannot go in for vaccines that are stored at extremely low temperatures, knowing very well that we can only store very small quantities. In any case, it would be very cumbersome for us to move to the vaccination sites with vaccines that we have to maintain at -80. The capacity is only available for about 500 doses. And since we have capacity for other vaccines, it is only wise that we pick vaccines that are stored between 2 to 8 degrees. The population that goes to the bars and the other places of entertainment are also citizens of Uganda, and they are grouped according to the priority groups that we have been communicating. In my previous communication, I clearly indicated that we will start with health workers. We will also vaccinate our security personnel because they are at the front line. We will also vaccinate our teachers. We will also vaccinate the population 50 years and above and those with comorbidities. I am pretty sure that among those groups that we have indicated, some may be found in those very areas that you are mentioning. So they are part of the eligible population. Suffice it to say that after vaccinating the priority groups, all the other groups, all the other population will be eligible for vaccination. That is the population less than 50 years of age up to 18 years of age. So from 18 to 50, that is the next group that we shall vaccinate. And as I mentioned earlier, we shall be providing a vaccination program. You will know exactly where you can go to access your vaccine. So within the course of this week, you will be receiving the program and how people will get vaccinated. So if you are above 16, you are eligible for the vaccine. And the population 16 years and above is estimated at 26.7 million people. So that is the population that we are targeting to vaccinate. Have we paid for vaccines? No, we have not paid for any vaccine up to now. We placed orders for 18 million doses of the AstraZeneca vaccine from the Serum Institute of India. We have just received the paperwork, including the invoices, so the national medical stores will pay either in the course of this week or in the course of next week, depending on how fast we are with the paperwork. I cannot tell you what the balance is because the balance means the balance for the 26 million doses minus the 400,000 doses. So what Ministry of Health is working out, we are getting out all the donations if we are sure that the donations are coming, and then we shall work out the costs of the rest of the vaccines. But then we have to be sure what kind of vaccines we are bringing into the country. So we cannot tell you for sure that this is the balance we have now because the costs of the vaccines vary and it depends on the type of the vaccine. So as we procure vaccines, we shall be telling you the costs and how many population groups it will cover. Yes, during the first wave of the COVID-19 pandemic, the Ministry of Health made efforts to ensure that we have adequate treatment facilities and beds. And tents were procured when our hospitals were full and supplied to various regional referral hospitals, together with the beds and the necessary equipment. This is for you to take note that the tents are not for managing moderate, severe, and critical cases. They are for managing mild cases that cannot stay at home. And so the equipment that are required in those tents are only beds. And the beds were provided for, but beds cannot be put in the tents when there are no patients. for security purposes. So should we get a second wave, beds will be installed and patients will be able to access them. However, in the meantime, we cannot dismantle the tents because we don't know what will happen. We are not yet getting zero cases. There are still some cases coming in, and so the Ministry of Health has to remain on high alert. If you go on the COVID-19 vaccine market dashboard, you will be able to access the costs of the various vaccines. The cost of the Chinese vaccine on the dashboard is $44. However, we have initiated discussions with the Chinese on the possibility of procuring these vaccines. However, again, let me hasten here to say that the vaccine has not yet been approved by the World Health Organization, and so these processes are going a little bit slowly. So we are working on it together with the government, with the Chinese embassy, and as soon as it is communicated to us, we will let you know. The World Health Organization provides dates for approval of vaccines, just like it did for the AstraZeneca, which was 15th of February. So will it be done for the Chinese vaccine. However, countries are free to decide on the kind of vaccines that they want to use in their country, depending on the scientific evidence and guidance by the scientists. In conclusion, I would like to appreciate the media, both locally and internationally, and the general public who have continued to support the COVID-19 response, which has enabled us prevent further spread of the virus. However, I want to appeal to the Fourth Estate to always verify information from the respective authorities to avoid derailing the population from the gains we have so far achieved. The general public should continue following the standard operating procedures in order to prevent COVID-19 infections. It is your responsibility to protect yourself and your loved ones. COVID-19 is real, it is dangerous, it spreads fast, and it kills. Stay safe, stay alive, for God and my country. I thank you.